Hi guys, good morning. This is Dr. Jenny, user physical therapist and doctor of physical therapy. And if you're United States of America, good morning. And if you're in Philippines, magandang gabi. In Philippines right now, it's nighttime. So magandang gabi and mabuhay, guys. If you're in United Arab Emirates, to my colleagues and friends in United Arab Emirates and Saudi Arabia, Salam Alaikum and Ramadan Kareem. So, guys, it's another thanks God. It's Thursday. Tonight, we will have Dr. Joni Barry. Dr. Joni Barry is a physical therapist, a doctor of physical therapy, and a neuroclinical specialist. All right. And she is now a professor in Maryville University. And she has more than 20 years of experience and also doing more on inpatient rehab, stroke rehab, more neurological cases in St. Louis, Missouri. Right. So, and she worked also in Mercy Hospital before in St. Louis Hospital. Oh no, St. Louis, Missouri. And right now she is a professor in Maryville University. So it's a really great opportunity. And thank you so much, Dr. Joni, for this opportunity. And we will learn more about how she transitioned from physical therapist to an academic. What's the benefits? What's the challenges? And also, if you know her and you see her profile in Facebook, she just won in the weightlifting competition recently. We'll get to know more the benefits of weightlifting, why we need to do that, things like that. All right. What is CrossFit? What is weightlifting? What's the benefits of exercise? Recently, right now, resistance training is very, very important, just like the cardiac. All right. Here we go. Dr. Joni, thank you so much. Good morning.
Thank you. Thank you for inviting me and wanting to speak with me.
Of course, yeah. So we are so grateful to have you. And then we are really looking forward to know more. Tell us more about your challenges in being an academic, in the, what do you call this, in being a professor.
Academia.
Yeah,
Yeah.
academe. Yeah. I keep
Yeah. So it
saying
was,
like academy.
I
Academy.
kind of had a gradual transition. I would say a lot of physical therapists start becoming educators when they're clinical instructors for students in the clinic. So I was working in an inpatient rehab setting most of the time that I would take students. And I found myself wishing that they knew a little more treatment ideas coming out of school. It was kind of like they would do an evaluation and you'd say, okay, tomorrow when you come back, what are we going to do? And they would sort of be out of ideas after the eval. And so as I got my NCS, which was actually in 1997, I was invited to just first guest lecture for just one particular topic at Maryville. And then the next year to be an adjunct instructor, which is where you don't work there full time, but you just come in part-time. And I just taught one particular course. And I did that for 6 years or so. And then I had actually started and finished my transitional DPT. And the timing was just kind of perfect as my youngest child started kindergarten and I didn't need the daycare that was associated with the hospital I was at. They also had an opening for a full-time position that I was offered. And so that was 17 years ago. So I transitioned into full-time at the university, but I stayed part-time at Mercy because I didn't want to let my patient care go. So I don't know that answered the challenges exactly. The challenges are always trying to stay current with intervention ideas and treatments as you're teaching, which wasn't too hard when I was working 2 half days a week in the clinic, because I would see patients and be able to bring them up in class. But a couple of years ago, I did step away from my clinical position. So now I have to really work to stay current.
Yeah, that's really good. Yeah, that's awesome. It's really challenging right now. Like me, I'm working at home health, Dr. Joni,
Mm-hmm.
and then I also educate sometimes and then there's an offer of education also in small college here. And I want to educate more on the experience, like how to be a physical therapist and what the cases. And then when they
Mhm.
ask me, all right, this is the manual. You need to really follow the manual, and these are the things. And it's tough for me because I just want small hours. I just
Yeah.
want to do like, it and then you will really be an instructor, you will really be a teacher. I said, it's a little bit difficult. I need to study more like my anatomy stuff, you
Yeah,
know.
having students makes you have to, if you ever have or a clinical instructor, you feel like you need to be really up on the things. So I think, yeah, we teach our students, but we also learn from them, and we learn getting ready to teach them. So
Yes.
I actually did a little TAing way back when I was a student, and I realized that I learned anatomy a lot better the second summer when I TA'd than the first summer when I took it.
Yes, that's really true. We will really study it for them because they have this book and everything, so that's really wonderful. So what did you notice? You said that the interns, the students, you see that they have a really basic knowledge. And if in your practice, what do you want to emphasize in these new students?
Well, I think,
They have weaknesses, and what did you notice in particular? These are the norms of these new incoming students, and what do
yeah,
you want to look for
I
and
think that
improve?
students, they look for like this one certain exercise that they would do no matter who the patient was. Like they just have, a certain thing they want to do. And I would rather them really start by what does the patient want, and to make it as personalized and individual, and still have, intensity and make it fun, and not to just be so basic that they could do the same exercise with everybody. And I think even myself as in the clinic, I saw that I kind of, for a while, would do a lot of the same thing all day long with lots of patients. And then I've kind of transitioned where I could just, not even hardly know what I was going to do until I said hello to the patient and asked what they wanted to do that day and what they wanted to get better at. And then I could come up with the ideas on the spot. But that just takes time. It's, you can't expect that right away. It's
That's it.
definitely a process.
Yeah, that's really true. And congratulations, Joni. Congratulations in your competition. Tell us more. What is this competition
Oh,
all
thank you.
about?
So I was a few weeks ago in the USA Masters weightlifting competition, the national meet, which was actually interesting in this time and day. After not having any face-to-face meets for a year due to COVID, and having some kind of online where you'd send in a videotape types of competitions. This one we were able to do some social distancing plans and have it live in Orlando. So anyhow, this was weightlifters. The oldest in the men's was a gentleman who's 89. And the youngest that qualifies as masters is the year you turn 35. So some people could have been 34 going on 35. And then for women, the oldest women I think was a 75 and up age group. So between 75 and 79. And then, yeah, I compete in the middle there in the 55 to 59-year-old group. And then you also compete by weight category of what you weigh, in kilograms. So anyhow, I got 2 bronze medals in my group. So that was good.
Wow.
Last year when I did my first national masters, it was online and I got all 4th place. So this time at least I got 3rd, 4th, and 3rd.
Wow, congratulations. We saw
Thank
the
you.
video. I posted it in the Balance and Fall support group.
Yeah.
And then it's really nice, the colorful and also the bronze medals that you got. You said that it was a 2 categories. So
Yes.
where's the passion coming from, Joni? When did you think or when did you learn that weightlifting is good for me, beneficial? When was the time that, oh, this is good for me? And how did you begin with that? I remember you say something about CrossFit first and
Hmm.
then weightlifting. Tell us more.
Yeah, so I have back in the day in my youth I did gymnastics actually all the way through college. So I competed at a Division I school. So I was used to, exercise, and I've always had good upper body strength just from that. But then again, went to PT school, got married, had 2 kids, and I really didn't do any organized kind of fitness for till my kids were really teenagers, and I felt like kind of didn't need me running them around as much. And I was also actually, my cholesterol was going up, my weight was going up, and I knew that I had to practice what I preached a little bit better. So I really just started with like personal fitness and going to a general gym and doing some exercise classes. I've never been like an aerobics class or a run a marathon kind of person. I kind of like things that are a little more kind of type 2 muscle fiber, quick things. I'm not an endurance person. But anyhow, I knew my doctor wanted to start me on statins, and I didn't want to do that. I've always struggled with my blood pressure as well. So I just started asking him if I could have the summer to eat better, exercise more, and see what happened. And my cholesterol did get a lot better. My HDL went up, my overall went down. And so then from personal training, which can be pretty expensive, my sister got me to try some CrossFit classes, which is a type of exercise where you do a mixture of some little bit of running and a little bit of things like push-ups and sit-ups, just body weight movements, pull-ups, hanging from a bar, handstand push-ups if you can, but there's always ways to kind of come up with an easier option and scale it a little bit. But also some barbell movements, which I had never done anything with like a full barbell, which is like clean and jerks and snatches are the big 2 movements, but lots of front squats and back squats. And I actually found out I was pretty good at the endurance, at the strength part. And even though it's a good thing to make yourself do, I didn't look forward to a workout that had a lot of running in it. I was always happy when it was more barbell movements. So I did that. And actually, overall, I found like if I do some competitions or know that I've got them in the future on my calendar, even though I've got lots of grading to do and there's other things I could do, I make sure I get to the gym like 3 or 4 times a week. And it'd be really easy just to say I was too busy if I didn't know that I had something to get ready for. So I started to do some CrossFit competitions and compete in kind of an online worldwide open that they have every year just to kind of have something to train for. But I ended up, I don't know if I've told you this, but 5 years ago, I ended up to need a pacemaker because of a type 2 second degree heart block. So once I had the pacemaker, which has a top limit on it, doing those CrossFit competitions where you would do lots of workouts spread out through a day where you really push yourself, and I would hit the top heart rate of my pacemaker, and that would cut me in half and like not let me go too fast. And I felt like by the end of the day, I had hurt myself more than I'd helped myself. I just didn't feel well at the end of those. And I had an opportunity with a new coach to do some weightlifting meets, which is a little more contained. You're just really competing on the day of a meet, 3 lifts of snatch after you warm it up, like 3 that you compete, and 3 more of clean and jerk. And so all your work is done in about 2 hours. And I wasn't pushing my heart rate the same way as CrossFit. So it just became a better fit for me than doing CrossFit right now.
Yeah, that's really good. That's interesting. And now I learn more about what is more of what you're doing in CrossFit. It's more on a little bit more on fast pace running because it's really different when you're just doing weightlifting. And Joni,
Mhm.
you taught me also the difference between I keep saying body weight, and then you said no, this is like a, more on the weightlifting. So what is the difference between that body training or bodybuilders? I think that's what I said.
Mhm.
So it's different if you're a bodybuilder on the weightlifter. So am I right? It's different. I
Yeah,
think they
there's
are more
different. And I
on
think in general, I don't think one is best, right? You always want to do, like just like patients, you're going to be most compliant and do your home exercise program
okay.
if you enjoy it and if you don't dread it. But bodybuilding in general is more just like maybe you're holding dumbbells, like the one in each hand versus a barbell, which you hold one bar in two hands, and doing bicep curls and, pressing it overhead and laying on your back and doing like a bench press. But people that compete in bodybuilding, it's more about, that's like when you stand on the stage and pose and try to show your muscles. And I don't know that I have that much muscle definition and that desire to stand and just be looked at like that. And then there's powerlifting. And powerlifting, which I've also done some meets, you do bench press. And again, you try 3 times and they take your best. You do a back squat and you do a deadlift. And, those are all part of what I do in my training anyway. But I don't typically do those at a competition, but that would be like a powerlifting competition. And then Olympic style weightlifting is even though you train a lot of things to overall have strength and balance, in competitions, it's really just the snatch, which is where the bar goes from the ground to overhead in one quick motion and you hold your hands a little bit wider. And then the clean and jerk is where you first bring it to your clavicles and pause there, and then you kind of press it up overhead. That
Ah,
part's the
I'm
jerk.
about to ask you that. So I
Yeah.
said,
So
you talk about snatch and then clean and jerk. I said, I'm about to ask you what is snatch. So
yeah,
that's
it's
the
it's kind of
movement
like
I
using
see.
PT lingo around your friends, right? There's
Mhm.
different terminology. But one thing I would say, I always am impressed at the competitions, especially with the masters ones, is how much of a balance challenge that is. And it's a really quick, explosive movement. And you just know that they're also going to the gym, a few times a week, or now this year, a lot of people have come up with home gyms and ways to train at home. But you don't always make every lift, like, because you're trying to do your best at a meet. And so you're putting a weight on the bar that you don't 100% know you're going to make. And so sometimes you do lose your balance, right? You'll see people, try a lift and get a little too far back on their heels and sit back onto their bottom. And these people that are in their 80s, some of the men and the women in their 70s, they'll fall backwards, drop the bar in front of them, and they just pop up off the ground like very fast. It's not a struggle to get up from the floor. They don't get hurt on the fall. I didn't see a single person injured at the meet,
Wow.
so and it's not because that they don't do anything that they have a failure, but you kind of learn how to fall in practice. I think it really helps with bone density. You have to be careful if you're going in already knowing that you're osteopenic or osteoporotic, and you have to, use good judgment. But I think we all know that just like our nervous system is plastic, our bones can change, right? And we can have a good impact on them and really help keep them strong through the muscle pull, I think. And some of it is just through the force through the ground. But I feel I've had bone density tests twice now in my 50s, and I'm like excessively, my bones are like a +3 on that Z score. So, they pretty much said we probably don't even need to check it again for 10 years because it
For
also
10 years.
changes slowly. Yeah. So I know that if someone has low bone density and they want to start, you have to go gradual, and sometimes you're just happy to see it stay the same year to year or a slight increase. It's not something that goes up quickly, unfortunately.
Yeah, that's really good. I love how you explained that to us, Joni, especially the benefits of this in preventing osteopenia, sarcopenia as well, because it's more on muscle,
Hmm.
also muscle
Yeah,
mass.
definitely.
So,
I think, yeah, I kind of, we can always, there's a few Facebook groups. If anyone out there does any weightlifting or CrossFit, there's some masters, women who lift, and there's just masters lifting kind of groups out there. And lots of women share stories. And there's just women out there in their 70s and 80s who take up exercise that didn't particularly do it before and really show how their body can change even postmenopausal, right, for women. So, it maybe isn't the same. I watch teenagers at the gym who come in brand new and lift less than me, pass me up. And, it's great to see them do well, but my progress is much slower. And sometimes it's just an accomplishment to keep the numbers the same as I move up an age category. But yeah, it's still fun.
Yeah, I like when you said you begin around 40s when you first touch the barbell.
Yeah.
I'm looking forward for more equipment now. And then so it's not too late for us to begin. Imagine I keep saying I want to be like them to improve. Some of our physical therapists, Dr. Joni, are including it already. High resistance training, doing body barbells in their outpatient gym. You know,
Hmm.
especially we have colleagues in New Jersey. They have a program of TerraX as part of their program. Instead of those typical TerraBand that we
Yeah.
have, they have now some barbells. And can you
Mhm.
tell us more? What is a good barbell? Like, what are your recommendations
Yeah,
on
I
this
mean, brand wise,
barbell?
there's a few brands out there, and you can, if you're just doing things like deadlifts and back squats, you don't need a high quality barbell, right? Women tend to use a little bit thinner bar, and it weighs 35 pounds or 15 kilograms, and a men's bar is thicker. So it's not a bar I'd be comfortable like putting up over my head. But that one happens to weigh 20 kilograms or 45 pounds. And that is both women and men for competitions use that size bar for powerlifting. So those kind of things, squats and deadlifts and bench press, I'm comfortable with that size bar. But they actually also have lighter weight bars that youth use and that some of the older age groups can use so that you can still add weight to it. And the overall weight's not that much, but it's like a 15 pound or 7 kilogram bar that you'll see as well.
That's
But
good.
what I would say with patients is I used to, even on my own, go to the gym where you'd cycle between different weight machines,
Mhm.
and there'd be the knee extension machine and the leg press machine, which works similar muscles to a squat in your legs, but it's so much different that you don't have to use your core and keep your balance. You can just lay on it and not think about the rest of your body and just push with your legs. But that's not the same as how we stand up and sit down. So if you know that you can do a squat with half of your body weight or all of your body weight on a barbell that's on top of you, then you also know you can get up from the ground or climb stairs without a railing, because that's only your body weight, not your body weight plus another load of your body weight. So it gives you confidence in what you can do functionally. And actually in CrossFit, they kind of call it functional fitness. There's lots of exercises that are essentially getting up off the ground with some weight, squatting with weight on you. And on the Facebook groups, it's funny because women will post, like women in their 70s will post, I was at the store today and I got the big thing of, 24 water bottles and put it into my trunk. And someone asked if I needed help. And I said, no. Or I carried bags of mulch and I got something off the shelf for a gentleman who couldn't do it because his arms wouldn't go up that high. So it really does carry over into doing what you want to do in life, being active with children and grandchildren, and just, but everyone has different exercise. If somebody loved hiking and hated going to the gym and exercising indoor, then I wouldn't say they have to do it, right?
That makes sense.
Yeah. I like air
Especially, yeah.
conditioning.
So we have
And heat.
all our different why. So
Hmm.
other clients will think of, I want to strengthen to carry my granddaughter. I want to, because I am alone in my house. I
Hmm.
need to be more independent. I want to do this resistance training because I need to carry all these loads. As
Hmm.
what you've said. And
Yeah, so I think if
we
with our
prevent
patients,
ageism.
we don't push the intensity a little bit to more than what they have to typically do, it's good to have that surplus, right? To have them know that they could do something harder than just climbing stairs. So then just stairs aren't that daunting, So we do things like in my accessory work, because I was just doing this just last night at the gym. You hold a I was holding 20 pounds in each hand, so 40 pounds altogether, and just doing an exercise where you kind of, if you picture those little um, things that look like a bird and its beak goes down to the ground, and its butt comes up. I was just standing on one leg and sort of pivoting over and bringing the dumbbells towards the floor while my one foot went up behind me, and standing back up from there, and keeping my other foot off the ground even when I came up, and then going down again. So it's single leg balance, but it's also using my hip extensors to bring myself up with extra 40 pounds hanging off the ends of my arms. So you really can combine balance and strength, and it didn't take anything too fancy, and you could be creative and hold milk jugs, or, you don't even in home health need fancy equipment when you asked what barbell to buy. But if you want to do the Olympic lifts, then you kind of want some quality of products. And I would recommend, before you purchase anything expensive, going places and using their equipment and just paying the membership. I
Oh,
haven't bought my own barbell yet.
that's a good point. Yeah, just now I am playing around with different equipment. I begin with the deep squat, and then there's a row as well. I
Hmm.
just got it, and my daughter keep playing on it as well.
Hmm.
So we just begin with that, and I'm already sore. And
Yeah,
I
and it's
really
okay to,
inspired
you
from
can't,
you.
I think it's knowing for patients to not, and I don't say no pain, no gain,
Mm-hmm.
especially while you're doing things, but it's okay to feel sore.
Yeah.
For me, it's 24, 48 hours after I do something, especially if where I'm sore is my muscles and not my
Yes.
joints.
Yes.
If I'm sore in my muscles, it's just a little bit of the process. But I also know maybe when I overdid it, and if that's too
Okay.
sore, you kind of have to keep your ego in check. Sometimes when you, especially for me with kind of being the older one at the gym and seeing younger people doing heavier stuff, you just have to congratulate them and not feel like you have to match it.
Yeah, that's really good. I have the privilege, Dr. Joni, to interview one of the innovator as well of the very good portable gym equipment. He
Hmm.
has already a dial. It's a Max Pro Fitness. You have able to dial the different loads,
Hmm.
and then it's a good pulley. It's shorter and it's easy, and it can
Yeah.
use also for the legs because
Yeah.
the
And I do
dumbbell.
some,
Yeah.
yeah,
Go
I'm not against using machines at all, because I do like pull downs with the pulley system like that.
Yeah.
Because if your whole body weight's too much for pull-ups, it's another way to work the same muscles.
Mm-hmm.
But just things like, instead of a leg press machine, to think about squats, holding a little bit of weight, and things you can do where you have to use your core or keep your balance. You just get a little more bang for your buck than doing sit-ups plus the leg press machine. You could get all that work done if you just, have people, hold their own balance instead of lay on a machine.
Yeah. So what will be our precautions? Some of the contraindications or precautions that we need to be careful of if we want to go in this path of strengthening
I mean,
weightlifting.
I think you want to, before you go through any movement with weight and with a lot of speed, you'd always want to check people's flexibility, right? Do their ankles have enough dorsiflexion? How much hip flexion does somebody have? I mean, and I always, every day, I need to warm up before I do these things, because I don't tend to be very flexible. And I'm right at the end of my ranges in my shoulders and in my hips. And if I did that with weight before I did it with an empty bar and even just laying down and stretching. But if I was treating a client, especially with either a neurologic issue, or who had not been very active and now they were trying to be active, is have they had a bone density test done, and what were their values? And if they were osteopenic, I'd be cautious. But if they had osteoporosis, I might want some guidelines from a physician, and I might do body weight and nothing else, for a while. A little bit of plyometrics ultimately, but it's we don't want to break a hip, and we don't want compression fractures in the spine. But if that same person with osteopenia sits home on the couch and does nothing, it's only going to get worse. So I think you just have to tread that line of loading the bones, but being smart about it, and, knowing just it's going to take time to have improvement. So your muscles, I think, can actually gain strength a little bit faster than your bones. But even if someone's muscles were getting stronger and you knew they had really bad bone density, then I would, just, I would be happier with like 10 reps of a weight that's lighter and not pushing for 1 rep maxes,
Oh.
just to kind of do this more sustained
Mm-hmm.
multiple repetitions and not worry about a single thing, because you just don't want that, you know, adding 1 or 2 more pounds and kind of being that straw that breaks the camel's back. So,
That's really
but I think then you want to hope to hear that because of what you're doing, strength training, that daily things are getting easier for that patient, and really asking them, still bringing it back to what they want to do. But I think bone density, you have to watch some cardiac stuff too, right? Taking vital signs. And if
yes.
you guys have been in the vitals or the vitality of vital signs, really trying to get everyone at the beginning of a session, and again, maybe at the end, taking
Okay.
heart rate, blood pressure. Because if people are, straining with heavy weights too, the other thing you worry about, is pushing blood pressure too high, and,
Okay.
I have to watch my heart rate just
Mhm.
because of my pacemaker. I know what my top rate's supposed to be. It won't let me go slower than a certain number, but it can, if I hit the top rate, is where I don't feel well. So,
Wow.
although I don't have a defibrillator, if someone had a defibrillator
I see.
implanted in their pacemaker, then
Mhm.
I would really stay below that top rate, right? We don't need to defibrillate people, hopefully.
Okay, that's really amazing. Imagine you're doing those weightlifting, you have a pacemaker, and then you really inspired us, Dr. Joni. So thank you so much. So that will be, I think that's a wonderful informations you put there, and you even gave us some tips about that. So how about our listeners if they are the clients and caregivers? I like the your t-shirt, get fit for life. So so that's really the message, guys. Get fit for life. There's no age
Mhm.
here. And age is just a number. And Dr. Joni just explained to us in the competition there is like 85 years old in the women's if there's a 79 years old, the youngest is 35 years old. So it varies.
Mhm.
So it's all up to you how you will begin, increase the frequency with less weight to begin with, and then later on, and check with your experts, check with your doctor, your healthcare clinician, some of the precautions that you might have. So, Dr. Joni, any closing remarks, any tips for us who wants to be in your field for your going to academy again academy I keep saying academy and
Academics.
also and also if they want to be more on in this how to begin weightlifting any
Yeah, so if
suggestions?
anyone wants to reach out to me with any questions, I think my email and contact information on social media is going to be posted with this. But if you're interested in teaching and you live in an area where there's a physical therapy program, reach out to them and offer to be a lab assistant, or tell them a topic that you really are passionate about, and ask if they need a guest lecture just for the day. So there's definitely a need, a shortage a little bit of academic teachers, but sometimes the thought of going back and getting a PhD could be daunting. So if you've got any kind of specialty, or just help us in keeping a clinical instructor and taking students, because that helps schools more than you can imagine. If you hadn't taken a student and you just start taking students on clinicals, then you are a part of their faculty the way we consider it for accreditation. So even just taking students would be great.
Thank you so much. That's really true. Just check out with your closest schools, university, if that's really your passion. Being an educator, I have some colleagues in Malaysia, Dr. Joni, they just
Mm-hmm.
asked me to be a guest speaker
Oh, awesome.
initially, yeah. And then they are students of physical therapies, and then later on they asked me to be an adjunct instructor, as what
Yeah.
you said. Yeah, so if you first give some information as a guest speaker, then later on if the student feels comfortable with you, and I'm focusing more on geriatrics in their
Mm-hmm.
what do you call that, yes, as an adjunct instructor in
Yeah.
Malaysia. So
Great.
that's
Well, thank
really
you so
good.
much.
I love to help. Yeah, it's good. I like there's an instructor a little bit. They understand English very well, but if
Mm-hmm.
they're just not really fluent, the speaking just straight. But
Yeah.
they are really, really wonderful students as well. So that's really a challenge, another challenge for us. So thank
Mm-hmm.
you, Dr. Joni.
Yeah.
We
Thank
really
you.
learned a lot. We are inspired from you. We're motivated. Now I'm really eager to do more. Imagine you begin at this age around 40s. Now I see
Yeah.
the difference. I love your skin. You're so young.
Oh, thank you.
Yes, I can see it. So guys, if you have any questions, we can connect with Dr. Joni Barry. She is a professor in Maryville University. She's a physical therapist and doctor of physical therapist. And if you want to learn more about what we call this, the NCS, so she can also give you some tips on how to get an exam, and it's in APTA. So some of those tips and good books to read. So thank you so much again, Dr. Joni. And guys, if you have any questions and want to learn more, connect with us with Balance and Pulse Support Group. Check out her Facebook page and you will be inspired with her snatch and catch. That's why I keep thinking, Dr. Joni, I keep thinking, why they just leave it like a boom, like that,
Yeah.
you know?
And why
So
we
I said,
drop it
why don't
afterwards? Yeah.
put it back? Maybe I know. And
Yeah.
I see the spot. What do you call that? The spatter? Is it what do you
Well,
call
they
it?
have yeah, powerlifting, you'll see spotters, but on Olympic
Powerlifting.
lifting, it's just you by yourself on the platform.
Gotcha. So it's powerlifting that has that.
They do spotters. Yeah, that's,
Mm.
yeah.
Now I learned a lot of difference between bodybuilding, that
Yeah.
they put an oil to make it like a
Yeah, you
muscle
in a
definition.
bikini. Yeah, that
All right.
I don't see that in my future, but you never know.
All right. Thank you so much. I really enjoyed this and I learned more. Thank you, Dr. Joni. Thank you guys for listening. It's another wonderful podcast for Thanks God It's Thursday. Connect with us with Balance and Pulse Support Group. It's me again, Dr. Jenny, Yusuf, physical therapist and doctor of physical therapy. Every Thursday, we interview great innovators, professors, physical therapists, and entrepreneurs. So I hope you learn more about our um, professor today and our guest for today and connect with us. It's me again, Dr. Jenny, clinical specialist in geriatrics and also creator of Balance and Pulse and your vice chair for global health in aging adults. Exercise is medicine, get fit for life. That's our APTA before years ago our what do you call this?
It was the slogan for
Yes.
PT month. Yeah.
Yes, for PT month. All right. Bye, guys, for now. And be safe always. Take care.